Gavin Newsom in a recall election. British researchers have developed the world's most effective malaria vaccine. The new treatment is the first to achieve a World Health Organization's 75% efficacy goal, and scientists say they hope it can be approved for use within the next 2 years. Some breaking news to bring you, and in the last few moments, President Biden has said that travel to the UK and Belgium in June, I'm afraid I need a bit more clarification on that. Biden will travel to the UK and Belgium in June. That's according to the White House. Of course, we know that the G7 is taking place here in the UK then. So that is confirmation from the White House that the President will be attending and will be coming here in June. Now, India has been added to the UK's red travel list from 4 a.m. this morning, with all arrivals from the country now having to enter hotel quarantine. Over 330,000 cases have been reported in India today. That is the world's highest ever daily tally, which it has now recorded for the second consecutive day. Well, doctors say that they are warning that the country's fragile healthcare system is at breaking point as they plead to be supplied with more oxygen. Well, India has been added to the UK's red travel list from 4 a.m. this morning, with all arrivals from the country now having to enter hotel quarantine. Over 330,000 cases have been reported in India, and that, as I said a moment ago, has been the second consecutive day. Well, joining us now from Oxford is Dr. Duncan Robertson. He's a lecturer on policy and strategy analytics at Loughborough University and joins us now. So the situation in India, extremely concerning.
Absolutely. So rather like we had over Christmas here, the cases there are really kind of getting out of control. And I think what we've seen is, the pressure on the hospitals over there. And of course, you get the pressure from the disease itself. But of course, when hospitals get overloaded, you get additional mortality because, just the whole system is becoming overloaded. So I think, it's maybe sort of worth kind of thinking about what's happening in the UK and then thinking about the potential for some of these variants that we've seen in India. So I think if you look at the sort of cases that we have in the UK, if you look at that chart, we have really, compared to when we had our own variant, and of course we've had a variant, the Kent variant, and this is a chart since the beginning of our vaccination program, and so this is from December. And if you look at the numbers we had, for 20-somethings that in just around Christmas, you had there 900, so nearly 1% of 20-somethings were being diagnosed with COVID every week. And so we had huge pressures on our systems, and that's why we had to go into a lockdown. And as you can see, just after those numbers were reported, we had this very severe lockdown. And I think the other thing to think about is, it's green on the right-hand side, but it's still not as green or as low as we had over in June last year. So if you were looking at this slide last year, you would see every number on that right-hand side would be below 10, maybe not in the over 80s, which had about 12. But we're not out of the woods yet, and we have, about 3 or 4 times as many cases now as we did as the lowest point over June last year.
OK, what about the vaccine rollout? Because we are, we're doing really well, but it's not perfect. I mean, I'm one of millions of people still awaiting their first dose. So in danger of making it sound like a number 10 Downing Street press conference, but show us your next slide.
Well, next slide, please. What we find is we've had tremendous success in the vaccine rollout. And the reason that we see there, the older people being vaccinated is, of course, these are the people who have the highest risk. And we're taking very much a risk-based approach to vaccinate older people. And we've had some very high numbers of vaccinations in those age groups. But of course, we're still going through that program, and we still haven't quite reached the under 45s, or at least the under 45s who aren't working in health and don't have medical conditions. So there's still a huge range of vulnerable people out there, and perhaps these are people who are more likely to be mixing over the coming weeks. So it's not as though we're out of the woods yet. So we have, and of course, the vaccination program, at least in the last couple of weeks, has been focusing on actually second doses to try and get more protection for those most vulnerable. And the other thing is to say, of course, we have very, very high rates amongst the most vulnerable, but we don't have 100%. And of course, it's not fair the way, it's great that everybody has the opportunity, but if you actually look at the NHS statistics about who's been vaccinated, you do see disparity. You see disparity from ethnicity, you see disparity from urban versus rural locations, so you're less likely to be vaccinated if you live in an inner city. And the big thing is, of course, deprivation. So people from more deprived neighbourhoods are less likely to have had the vaccine than people from the least deprived.
Okay,
so that's a real problem.
Let's bring it into the context of India then, the situation there where we're seeing these huge numbers of cases. We know that they have this double mutant variant, and we now know that we've got 130 cases here in the UK. It's not been considered a variant of concern by UK authorities as yet. It is still very much under observation, but what more can you tell us about that?
Well, I think you make a very good point that it is still considered as a variant under investigation. And I think we have to realise that there are some very, very competent people making these sort of risk assessments. And one of the reasons that Public Health England can make these risk assessments is we have huge numbers of sequencing going on. So people who test positive, especially people from overseas, all of those, if they test positive, their sample will be sequenced, and then you'll be able to tell which variant is that case determined to be from. So I think if you look at the chart of variants, that we have several that have been detected over the last few months. So in that purple line at the top, we have the South Africa variant, and this is kind of steadily increasing. And I think I just should make clear, these are cumulative graphs, so they can only go up. So they're perhaps not as scary as they may look. But we have the purple variant, which is increasing at a steady state. We also have the other variant of concern, the red line. This is from Manaus in Brazil. And we also have this kind of new variant that we're investigating, which is this B1617, that light blue line in the bottom right-hand corner. And this is increasing relatively quickly. But Public Health England have done quite a lot of tracking of these people. And all but 3 of the cases that have been detected have been traced back to travellers or contacts of travellers. So, it's something where we have to really keep a close eye on it. And I think the other thing to say is, in order to become a variant of concern, it has to really do better or worse than the current variants we have. And of course, we have a very virulent, transmissible, severe infection in the B117 Kent variant. So really, it's not as bad, at least in the preliminary data, as that. But this is why a lot of analysis continues to be done.
OK, we have to leave it there. Duncan Robertson, always good to get your analysis, though. Thank you very much indeed. Well, if you've been watching this afternoon, we'll be giving you updates on Ryan Giggs, and we can bring you a little bit more information from Greater Manchester Police. It emerges that the incident in question actually happened in November last year. Let me read the full statement from the police there. They say a man from